Hello, this is Dr. Patrick Hu, CEO of Moffitt Cancer Center. We're coming to you from ASCO 2023 from Chicago, Illinois. Really happy to have Dr. Hatem Soliman from Moffitt's Breast Oncology Group. Thanks so much for being here with us.
Thank you for having me, Patrick.
Great. So, let us know, and there's so much going on in breast oncology. What's big here at ASCO this year?
Well, the biggest data that came out for this year was some interesting information from a trial called NATALY. So it was a big phase 3 trial that was looking at the use of another CDK4/6 inhibitor. These drugs are very important for the treatment of hormone receptor positive, HER2 negative metastatic breast cancer. And recently we had one positive trial that led to an approval for the use of one of those drugs in the curative adjuvant setting as well for women with high risk early stage breast cancer. And that drug is abemaciclib currently. NATALY was trying to look at the role of another drug in that class called ribociclib to see if it could also improve cure rates for women with high risk ER positive, HER2 negative early stage breast cancer. And the data that was presented at the conference this year showed that indeed ribociclib was able to lower the risk of recurrence by about 25% relative to women who just got endocrine therapy alone. And so this was felt to be a substantial reduction in the risk of recurrence for some of those women. And if the data plays out over time and is favorable, this may represent a new treatment option for women with higher risk hormone receptor positive breast cancer. And these women are the majority of the cases that we treat. So it could have a significant impact from a public health perspective if we are able to offer those women another treatment option to help further reduce their risk of recurrence.
So for these women, it would be a combination of hormone treatment as well as CDK inhibition.
Correct, yeah. So, and that's what we do now for certain women with high risk disease, but so it would give us another option basically, to select from on the basis of tolerability or other factors as well. So the idea is just to give us more options, if you will, to help those women.
Wonderful. Now, you're involved in a presentation at ASCO looking at TVEC, right?
Correct. Yeah, and it's an exciting piece of work that we were able to pull together, looking at a lot of different molecular analyses that were part of a phase 2 trial that we did at Moffitt. It was an investigator-initiated study looking at the role of TVEC combined with chemotherapy for women with early stage triple-negative breast cancer.
What is TVEC?
So TVEC, the long name Telimagene lahaprevec, is an oncolytic virus. It's a herpes simplex 1 virus that's been engineered to be able to attack cancer cells and cause them to rupture, basically, and we inject the virus into tumors. It's been FDA approved for patients with melanoma, as you're aware, and so that's basically where it's used as standard of care. But we wanted to see if by injecting the virus into triple-negative breast cancer tumors, could we enhance their response to chemotherapy? And indeed, we were able to show that in our phase 2 trial. Now, this presentation is more about looking at the analysis of the tumors through RNA-seq, analyzing some of the different gene expression profiles or mutations that were associated with either a better response or a less favorable response to the injection.
That's exciting. So what did you find?
Well, so we were able to identify some gene signatures that seemed to suggest that women with certain upregulated genes that were associated with more aggressive or poor prognosis triple-negative breast cancer seemed to respond better, actually, to the combination of TVEC with chemotherapy. So they had a higher chance of getting a pathologic complete response, even though they had molecularly more aggressive triple-negative breast cancers. So that was one interesting finding, which may allow us to potentially utilize oncolytic viruses to target those more aggressive chemo-resistant tumors, if you will. And then another interesting finding as well was that there was a mutation that was involved in a pathway that is responsible for dictating how the cells respond to a viral infection. So that mutation was associated with resistance to TVEC, right? And so we're hoping actually that by looking at that resistance mechanism, we could potentially better identify women who may not respond as well to the injection and utilize other methods to try to improve the response in those women.
It makes a lot of sense, right? If they have predisposed to fight viruses, then a viral drug is not going to work as well.
Yeah, exactly.
But it's really exciting that the more aggressive genotype that you found actually responds better. How do you think that's working?
Well, I think interestingly, and this is something that I reiterate to everybody that I talk to about oncolytic viruses with these types of tumors, is that because you have cells that are more aggressive and they're more rapidly dividing, that's actually a weakness in the face of an oncolytic virus. The virus actually likes those aggressive cells that are trying to replicate very quickly, because the virus can hijack that cellular machinery and make more copies of itself. So in essence, the strength of the triple negative breast cancer when it's more aggressive is like an Achilles heel to an oncolytic virus attack, right? And so I think that's why it's appealing to be able to incorporate something like this in the treatment of more aggressive tumors like triple negative breast cancers, because it gives us another, if you will, arrow in our quiver to target these tumors.
That's wonderful. So you're taking advantage of the fact that these tumor cells are growing rapidly, so you're giving a treatment that likes that.
Yes.
And can really kill them better. How exciting.
Yes.
Well, congratulations on that finding.
Thank you. No.
Dr. Hatem Soliman, expert in breast cancer from Moffitt Cancer Center.
Thank you, Patrick. Thank you very much.